anatomical position. You're standing upright, feet parallel, and flat on the floor. The upper limbs are at the sides of the body, and the palms are facing anteriorly toward the front, okay? The head is level and the eyes look forward, okay? So basically, anatomic position, standing up, feet parallel, flat on the floor, upper limbs are by your side, palms facing anteriorly, which is facing forward, thumbs up, out to the side, head is level and the eyes are forward. And this is always the position that a person will be in when it comes to anatomy and physiology or healthcare, unless otherwise specifically stated.
Right, so now we are going into the planes. Okay, so these are some of the major body planes. So number one, we have the mid-sagittal plane. The mid-sagittal plane cuts the body in half. So that's going to be right side and your left side. A way to remember this would be mid-sagittal, mid-middle. So you're cutting it from the middle. One of the clinical uses for the mid-sagittal plane is MRI, CT. And when you're doing like brain imaging, it's used for like also looking at the pituitary gland. So that's one of the cuts that they would use in an MRI or CT scan to visualize that and look into that. Number two is the parasagittal or the sagittal plane. So the sagittal plane is going to be exactly, the sagittal and parasagittal is the same.
Or I just know that sagittal means to cut the body in left and right parts.
Right.
Divide the body in left and right. Mid-sagittal is cutting the body equally in left and right. And parasagittal is cutting the body maybe just left and right, but unequal.
Okay. So I think parasagittal is the same as sagittal plane. If it is, then it cuts the body into the left and right, like you said, but not half, so off to the side. Is it? That's what it's saying?
Basically.
It's the same? Okay. So in a clinical field, it's used to view like injuries or one-sided stroke. Like if you have a right-sided stroke, they would use the parasagittal plane to describe or look into what happened on the right side or what is happening on the right side after having a right-sided stroke. All right, so for transverse plane, that's gonna be our cut that cuts through the body, top and bottom. So in the middle. This specific one can be a little tricky, but I think that one thing that helps me is I think tabletop. So like if you were to cut like a table, think of a tabletop that's slicing right in the middle of your body. And you're gonna be left with like the upper half and the lower half of your body. And the clinical use for this would be CT scans to look at internal organs like your liver, spine, as well as kidneys. That is that. Coronal frontal plane is going to be when the body is divided anterior and posterior. So kind of like a crown. So I think like coronal, crown, or front is frontal. You're going to be given the front and the back. Oblique is going to be create sections on an angle. So can you say that again, like about the oblique in reference to like this, just the example that it gave?
Okay. So an imaging request for oblique plane could be, let's do an oblique MRI of the shoulder joint. This gives a better angle of the tendons and ligaments.
And then what would it be for like coronal or frontal plane?
Or a coronal CT of the sinuses. The doctor wants to see a front to back view to see sinus cavities. So for parasagittal or sagittal, an imaging request would be, we need parasagittal images to evaluate lateral spinal structures. Or another one could be, the parasagittal slice shows inflammation around the joint. For mid-sagittal, it could be, we need a mid-sagittal brain MRI to check for midline structures. Or the pineal gland should be centered in the mid-sagittal plane. And then finally, transverse, or a transverse CT of the abdomen, which is a cross-sectional slice from top to bottom to see internal organs. Let's evaluate the spinal cord in transverse cuts. Or lastly, the tumor is visible in the transverse plane at the L2 vertebral level. It shows up in a horizontal slice of the spine. Okay, so next we have directional terms. And so basically this is very straightforward. We have anterior ventral, which is toward the front, posterior dorsal, back toward the back. It seems like these words can be used interchangeably. Superior, think up, like if God is superior, he's higher. Cranial, think closer to the head. So superior will be what's closer to the head, so think up. Inferior, some cultures are deemed inferior to other cultures, unfortunately, but think inferior. Caudal, I don't know, but it's just the words. Medial, so you want to think toward the middle. Medial. Lateral is going on the outside, so going laterally, going outward. So this is, I shouldn't have wrote it like that, but in and then basically out, toward the outside, away from the midline. Ipsilateral is the same side. Contralateral, like contradiction, is the opposite side. Superficial is toward the outside or toward the skin or closer to the outside. And deep is closer to the inside, more internal to another structure. And then proximal and distal is closer to the point of origin or the point of attachment. That's proximal. But with proximal and distal, you want to make sure that you remember to mainly use the limbs. It's mainly used to describe points on the limbs. So you don't want to get proximal and distal confused with superior and inferior, because superior and inferior is usually talking about what's on the trunk or the axial part of the body, which is the neck, the spine, the abdomen, that sort of thing, whereas proximal and distal is talking about the limbs. So some examples for proximal and distal would be proximal, the elbow is proximal to the hand. So the elbow is closer to the point of attachment, the shoulder, the hand. For distal, which means further away from the point of attachment, the wrist is distal to the elbow because it's further away. Going back up with some examples, superficial, so the skin is superficial to the biceps brachii muscle because the skin is outside, whereas deep, the heart is deep to the rib cage because the heart is deeper down in your body than the rib cage. You will get to the rib cage before the heart because the heart is so deep in. Ipsilateral, so your right arm is on the same side, or ipsilateral to the right leg, so it means the same side. Contralateral, remember contradict, so an example of that would be the right arm is contralateral to the left leg because it's on opposite sides. Medial, we can put the lungs are medial to the shoulders because the lungs are more toward the midline than the shoulders are. And then for lateral, we can say the arms are lateral to the heart because the heart is more at middle. The arms are obviously on the outside, so the arms are more lateral, or the arms are lateral to the heart. Inferior or caudal, so the stomach is inferior to the heart because the stomach is below the heart or further away from the head. Superior, the chest is superior to the pelvis because the chest is higher up than the pelvis. The chest is higher toward the head. Posterior or dorsal, these can kind of be used interchangeably, but the heart is posterior to the sternum. So the heart is behind or toward the back of the sternum. For dorsal, the spinal cord is on the dorsal side of the body, which is on the back side of the body. Anterior, which means we said front. An example of that is the stomach is anterior to the spinal cord because the stomach is more toward the front than the spinal cord is toward the back. And then an example for ventral is the umbilicus or the navel or belly button is on the ventral side of the body. It's on the front side of the body. So these are directional terms and examples.
We're gonna go over the axial region and appendicular region. So for the axial region, that is going to be the core of your body. So axial is the core. Think of axis, so everything in the center. So when we're talking about the core, what that includes is your head, so your cranial region, your neck, That's your cervical region. That's your trunk. That's going to be your thoracic chest. That's going to be your abdomen and your pelvis. So when you think of axial, that's going to be all of those things. The second part of this is going to be appendicular region. That's going to include your arms and your legs. So we're talking your upper limbs, meaning your shoulder, arms, forearm, hand, yeah. And then for your lower limbs, we're talking your hip, thigh, leg, foot. So a way to remember that is going to be like appendicular would be like appendages. So those are the parts of your body that hang off. So that's going to be your limbs, hangs off of your body. Yeah.
Thanks for studying with us, where nursing school is simple, sweet, and easy to repeat. If you found this helpful, please feel free to like, subscribe, and share with a nursing friend.
See you next lesson.